What's going on, everyone? Hey, I wanted to make a video showcasing some of the stuff we do in practice. I figured this would probably be the most compelling way to try to resonate with chiropractors that want better clinical outcomes and want objective measures along the way. So that's what MoveNow is all about in the background. So it says we teach chiropractors how to integrate their practice with functional movement in 90 days, but it's really the systems, how to quantify someone's progress. There's a lot of moving parts to it, but I pulled up a patient and I'm going to go through the findings one by one. So let me share the screen over here and I'll show you. Okay, so over on the screen, we got a lot of stuff going on here. Just showing you a bird's eye view first so you can see these are all the different pieces that we gather or we measure with a patient over a corrective care program. Remember, there's three things that we look at. We look at segment, posture, and movement. And depending on the patient, they might have more issues in one area versus the other. But what I found to be most compelling and the thing that we are trying to teach to the chiropractors is the movement aspect, the functional movement aspect, and then the systems to organize all of this and put it together. So here's a patient, he comes in and he's in his early 20s. So I'm gonna pull up this document first, okay? So if you can try to ignore all the other stuff in the background, because I don't want to bring it all off this screen. I want to leave it all right here and I'll just highlight each document as we go through. So this is basically a kid that came in, his parents are both patients, came into a dinner event that we were teaching, and he said, you know, I want to get checked out. I'm going to school pretty soon in the next couple of months. I don't have 12 weeks to go through a full corrective care program, but I have a little shy of that. How much good can we do? Let's at least do a workup and see what's going on. I've had this nagging mid-back pain ever since I can remember. Okay, so we go through. I'll pull this off the screen. So we go through and we did a workup with him. He filled out some forms. That last form I was showing you was our history. And he goes through and talks about he's painful and limited with bending, driving, lifting, moving objects, standing for long periods of time, mid-back soreness, pain is mostly what he has. It's moderate in intensity, but he's a young kid. He shouldn't be having this stuff. He's really athletic. He's been dealing with this for a while. So he wants to see if he can get it gone. So we go through and we do our examination. So we go through and we palpate instrumentation. We're checking range of motion, orthopedic, muscle tone, reflexes. Nothing's really going on all that major. Everything's fairly normal as far as orthopedically, neurologically, has some reduced range of motion, has some areas of segmental findings as far as edema, muscle spasm, joint fixation. Posturally, we stand him up. We look at different postural distortion, shifts and bends in his body. And then we decided we're on to doing some imaging, some x-rays of his spine. Now, this is actually a sneak peek. This is a before and after x-ray. I'm going to explain some of these findings here in a minute. I'm going to first talk about what we did, and then I'll go back and explain these findings. But this is his before x-ray. We look at it P to A, so left on the left, right on the right. And these little BBs, or I should say these big BBs, those are BBs that we tape on the skin on areas of findings. So we check someone with an instrument, we're palpating for edema, we're checking for point tenderness, muscle splinting, going through visualization, so going through range of motion, looking for areas of the spine that look like they are binding, not moving properly, in lateral bending or flexion and extension. And that's a key one, is take your patient, have them flex down and have them extend and just visually look at what the spine is doing. And you can see almost down to the segment in a lot of cases where things seem to really not be moving. We mark that area, we tape a BB on that area, and then when we take x-ray, we can then look at their static neutral posture. We can see what's going on with that intersegmental joint. Is there a weird angle at the disc on the lateral? Is there a lot of wedging on the AP? Is something going on there? It's just gathering more information so you can build a case and figure out what segments of the spine are going to be good candidates to get adjusted. So something that we do is we do very specific chiropractic. We do Gonstead chiropractic. We're looking for specific segments to adjust and put a deep specific setting into that joint in a very safe and effective manner, and not just superficial, gross manipulation, mobilization. So that's something that we are all for, is very specific chiropractic. Doesn't mean that you as a chiropractor have to do Gonstead, just have a specific approach. That's something that we stress and we feel very strongly about. I'm very biased, but that's something I feel very strongly about. So I'm gonna pull this over here. This is now, I'll show you a posture picture of this patient before and after. Kind of ruined the surprise showing the before and after right here. But he has some shifts and bends on the AP plane. The lateral plane is where things were changed most significantly. So his sagittal posture was changed most significantly. This increased rounding and bending up here in the thoracic spine. His head's coming back. You might look at that and say, well, he's just standing straighter. I'm going to show you his x-ray in a little bit and we'll talk through this. So we'll take all the skepticism out so I can show you that there is actually true mechanical change going on here. Now, this is an interesting case because this is a kid that he looks like he has a pretty good upright posture and you probably think he's pretty functional, but he has a thoracic hyperkyphosis, and there were some things that we did to help work on that. Okay. It was beyond just a poor posture thing. He had a slight spinal deformity. His sister, who we actually did a workup on too, we've seen the entire family, she has a thoracic hyperkyphosis, and so does the mom. So there's a little bit of a familial component here, it looks like. This is now his comparative x-ray. So it's before and after. The main thing I want to draw your attention to is the thoracic curve, this right here. So thoracic ARA, that's the curve between T1 and T12. So if we measure T1 to T12 and we look at what that actual angle is, it measured at an 80-degree curve. Ideally, it should be a mid 40-degree curve. And as far as the purpose of this video is not to teach the whole background of what this normal ideal curve model is. If you want more information on that, go to a chiropractic biophysics seminar, read and study chiropractic biophysics. We strongly recommend doctors going through that training. It's extremely valuable to understand normal postures, what is normal, how to fix these things as far as with traction and postural corrective exercise. The thing that we're doing is showing how do we put the whole package together and how are we adding the functional movement component and all the systems that really make this impactful for a patient. This is one piece of the whole equation. This is a technique right here as far as using posture ray x-ray analysis, using chiropractic biophysics protocols to improve posture. And then there's some functional movement things that we do as well that further improve and speed up the process of someone improving their posture. And there's systems we have in place to keep patients motivated to actually do their home care. That's one of the biggest, most important things. Patients can come into your clinic and do traction and postural corrective exercises and whatnot, but if they don't do any home care, typically their changes are going to be very, very slow or smaller in magnitude. There's always exceptions to that rule, but across the board, that's usually how it works. So we start off at an 80-degree curve in his thoracic spine, normal's mid-40s, went down to 59 degrees. This wasn't even over a 12-week period. This was, I believe, about a 8 or 9 week period. I'll have to pull up these next records. We can look at that, but it went from 80 to 59. So he reduced his thoracic curve 20 degrees, which is pretty cool. So he made huge improvements. The cool thing is 0 mid-back pain, doing great, functional, feeling awesome. He had things that were bothering him in the gym for years when he would do different weightlifting that would hurt him. That's gone. And now he has a routine that he does at home for the rest of his life. He's away at college. He's thrilled, super motivated, young kid following the system, like in his early 20s. I believe he's 20 years old, maybe even 19. I think about 20. Okay, so I'm going to close this. Trying to click on the close button. It's throwing me off. All right. So I'll pull this to the side in case we need to reference that again in a second. And then something that we do is we set goals with our patients. So this is part of the way that we get them to actually engage and go through this process of going through adjusting, exercise, traction, all of that, and doing their home care. So this is a form, and mind you, all the systems and stuff that I'm showing you is inside of our program, MoveNow University. This is what we teach other chiropractors, how to organize all the stuff, how to engage the patient, how to guide them, how to give them resources to go through this. And we teach the functional movement component. We teach how to analyze movement and then how to know what exercises to prescribe to fix the movement, how functional movement exercises and postures overlay, and just how to look at a patient and look at common ailments and issues, low back pain, hip pain, shoulder pain, and start thinking about these functional movement patterns that once you test them and they're faulty, it starts to explain a whole lot and it makes your segmental chiropractic approach that much more solid. So this right here is a goals form that we do. This is what we do with our patients on day 5. We set goals and we track goals. probably can't read my writing very well here, but over here, we circled thoracic spine. We showed normal as a 44-degree curve. He has an 80-degree curve. And basically we said, okay, let's see if we can reduce the curve about 15 degrees. Okay, in 12 or about 9 weeks, I guess what we had, 8 or 9 weeks. And remember, he had 80, the goal was 65. How did he do? He went from 80 to 59. So he exceeded his goals in even a smaller period of time. Didn't even take 12 weeks of care to do it, which is awesome. We then go down here and map out how many times he should be doing his home care. In this case, he was prescribed to do it 9 times per week. So his 2 visits that he came in the clinic counted as 2. He had 7 more sessions of doing his home care on his own. And for him to do his home care, it consists of doing spine remodeling traction at home, so like laying on a wedge at home, but also most importantly with this was him doing his spinal mobility and stability home exercises, stuff that he learned in our functional movement department, which I'm going to skip over here, which is this. So we have 8 different dysfunctional movement patterns that we check and we identify in our patients. We take them through a movement assessment. Okay, so I just pulled these documents in that I didn't have up here. We take them through a movement assessment, and we have a functional movement screen assessment that we have designed inside of MoveNow University. It's called the MoveWell 3. We look at 3 main things, which is neck and shoulder, back and core, hip, knee, and ankle. And so we take them through this check. We see if anything is functional, dysfunctional, or painful throughout. We measure range of motion when applicable. We check off these little boxes if there's little red flags or things that we see. The main thing that was dysfunctional with him was hip pattern, posterior chain, and squat pattern. Okay, so now those are things that we break down further to try to find what's going on. And then there's some special tests that we as the doctors can do to confirm the findings even further. And we score it. So you got a 38 out of 46, pretty good score to begin with. Not very dysfunctional. You know, he's athletic, but he has a couple things that are notable that need to be worked on, like a lot of posterior chain issues that need to be strengthened, even in a kid that's really athletic. His squat pattern needs to be improved, and hip mobility was definitely an issue. This was his comparative. He got up to 39. So he didn't improve all that much, but he improved a point. And he has more things he's going to be working on over the course of the next few months to improve his movement even further. But the cool thing was we ascended him through this functional movement model where he was able to do some complex movement, some loaded complex movements very safely. And we measure this, and we do this in the form of kettlebell movements. So I'm just going to show you right here. These are the 3 dysfunctional patterns that we flagged that we worked on with him for these 8-9 weeks, which was primarily hip dysfunction, squat dysfunction, posterior chain. We have this organized in these different colors. You see how it's all white protocols, then it goes to yellow, and then it goes to blue. So this is the belt system of functional movement. So inside the belt system of functional movement, we assign progressive exercises for our patients to do. And they start at white belt. Once they reach white belt, they can then test for yellow belt, and then they can test for blue belt. He got his blue belt, and a way that we rewarded him when he got his blue belt was we actually surprised him and got him a kettlebell. We got him a 20 kilogram kettlebell, so 44 pounds. So he was pretty excited about that. You can see those are his comparative x-rays in the background. This was the day that we were showing him the results of his comparative x-rays and all the different comparative findings that we did with him. So he's holding this kettlebell, he's stoked. And now we have a super motivated patient that understands these are things that he needs to be working on pretty much indefinitely. And he understands he needs to follow up with chiropractic. You know, now he doesn't live in town, but when he comes back in town, he'll get checked. He understands the importance of specific chiropractic, the importance of maintaining his posture, and the importance of functional movement patterns. So overall health, which is what we're trying to do as chiropractors, right? And I'll just show you a couple more things here. So this is something else. This is just showing the appointments that we saw him. And this is showing the type of traction that he was doing in clinic. All right. Now, if you don't have this kind of traction equipment and you don't know how to do this stuff, this is chiropractic biophysics protocols. There's some doctors in our program that go through the chiropractic biophysics training. Some of them don't really want to get into the traction part at all. something that we highly recommend is at least to do the home care and learn how to do the home care, and at least give your patients home care things they can do as far as like fulcrums and things to help reduce abnormal postures. So this is him doing an in-office traction, reduces thoracic kyphosis. He went through 16 visits of the traction. All right. And this is showing the visits that he came in from May basically to August. Okay, he's coming in primarily twice a week. And then this is really cool. We use Cash Practice Wellness Score. I'm a huge fan of that. I've worked with Cash Practice for a while. I really like their stuff. And it's just hugely effective for conveying this information to a patient, keeping them motivated. We have 21 different parameters that we look at. Originally, he started as a D, over here, 65% D, and he went up to a 84% B. We can see all these categories that we're tracking improvement, like one of them here, curve, thoracic, sagittal was 80 degrees, went down to really 59 point something. So we round up 60 degrees. So he went from a 10% to a 60%. So that affects his score overall. And we see how this plays in here. Neurospinal health, functional fitness, general health. So this is all Cash Practice stuff. This MoveNow University parameter set, that's what this is called, is actually inside of Cash Practice. And we have trainings and all these videos because we built this out for Cash Practice so that our MoveNow doctors could use this as well if they chose to use this additional way of setting and tracking goals for a patient, which I think is so important to keep them motivated and on track. And then this is something that we map out early on in care. Maybe I could have showed this earlier, but this is what's called a recommendation card. This is also inside of MoveNow University. We go through the training on how to fill this out and what this is, but these are all the things that we prescribed for a patient, and then they do either in office or at home, combination thereof. So it's showing how many visits are going to be seen, what their abnormal postures are, their postural corrective exercise, their home care traction, their in-office traction, their functional movement, flagged dysfunctions that need to be worked on, manual therapy recommendations, additional functional movement protocols, like he has some lower cross protocols that we put into place. And then also some things that we flag and mark to put into the wellness score, disc types, so abnormal disc degeneration, flagging that, noting that, making sure a patient understands that there's areas in the spine that are starting to break down. Okay, so I'm going to pull in something else here now. This is going to show some of the systems we were just covering, maybe explain them in a little bit more detail so you get a better idea of what we were talking about. So the belt system of functional movement, it's a way that we gamify the process. It's a system of progression for our patients. So they start at a white belt, they work their way up. You know, in the case that I showed you with this patient, he got up to a blue belt, which is the third level. You can see right here, it goes white, yellow, blue, green, orange, and black. And we have a full exercise library that our patients get access to on this online membership site called the 12-week transformation. This is, again, something that we also clone, and all of our MoveNow doctors have access to have their own online membership site for their patients, where they have an exercise library and they can follow all the same systems that we're doing here, which has been really powerful, really awesome. They go through, we then flag what dysfunctional patterns exist, and then that's what we start working on with them in office. We have some doctors that do this themselves. We have others that have exercise staff that do it. Like for us in our clinic, we have a fully trained staff that takes patients through this process once I prescribe everything out as the doctor. And then they have these different belts like you're seeing here that they wear. Ours say Gonstead Strong on them because our clinic's called Gonstead Spine and Wellness, and our tagline is results matter most. And other doctors put their clinic name, or they put 12-week transformation, or they put MoveNow on it. So there's a bunch of different doctors doing this around the country, which is really cool because currently we have over 135 doctors who have access to our systems. And so there's an exercise video library. So like, let's say that this patient I was showing you, let's say he had a cervical dysfunction. We could flag that, and then he could go home and he could look in his journal, because there's a journal that he also gets, which I'll show you in here in a second. But there's exercises that we show them in office. We can circle and flag what we did, and then they can go home and they can do that at home, and they could click on one of those little boxes that's online and a video pops up and it shows them how to do it. So we've made hundreds of videos in here that are specific to these protocols, organized in a really awesome fashion. So it makes it really clear and easy for a patient to follow. Patients are constantly telling us, wow, you guys have put a ton of work into this. This is so impressive. This is awesome. And that's the same feedback that we get from other doctors in other states that are also using this, is that the patients are blown away by how valuable this is, how helpful it is. The belt system takes you through all these different things. So it's a system of progression, but there's resources for the patient. And then the 12-week transformation, that's a piece of the belt system, because that's now the online resource that your patients have access to. Once you show them something in office, they can then go home, watch it at home. But it's more than that too. It's also a membership site that has weekly content for your patients to engage in, that reinforces what all of us chiropractors want to teach our patients: proper posture, sitting, standing, sleeping, how to lift properly, avoiding different toxins and things in the household, foods to eat, foods to avoid. So basically there's 5 weekly topics every week for 12 weeks. This is what we've mapped out. And we've made this universal enough so it works for any chiropractic office. And the majority of the chiropractic clinics using this don't change anything inside of it. Some of them say, oh, I want to add here or there. Well, you can fully customize it too, which is really cool. So there's 12 weekly resource lessons, and it takes them through this process of teaching them a bunch of good stuff. So here's what it looks like on our patient's end. And this is what's customizable that you can make it different for your end. Ours has got a picture of our clinic on the front. So you'd put a picture of your clinic on the login page for them if you'd like, and you could link that on your website. Very easy to do. We have all the training on how to do this as well. So we have all the high tech end of this as well. So it's not just how to do functional movement or how to take a patient through care, but it's like the whole package. There's drip fed weekly content. There's those 5 different topics: spine, movement, lifestyle, fuel, and goals. That's what we teach someone every week for 12 weeks. And it motivates them. So setting goals, there's exercise library, like I was saying, and we track their time and reward them. So like, you know, this other picture I was showing you of our patient holding that kettlebell, that was one of his rewards besides moving up into a blue belt. He got rewarded. We surprised him and rewarded him with a 20-kilogram kettlebell, which he was really stoked about. And there's a journal that our patients follow along with. That's what the journal looks like, so they can track what they're doing at home. They bring the journal into the clinic as well. And so like me and my staff are writing things in the journal for them. Like, here's what we showed you today. Here's what you should be practicing before we see you next week, for example. And so here's what that looks like. This is just a recap of all that. These are some slides that I had that I figured would be helpful in this presentation, is to pull that up. And there's emails that we send our patient that's attached with it, so it reminds them to log into it. So 12-week transformation looks like that. That's the main thing I wanted to show. That's an overview of one of many patients that we've taken through this process. We always lead with clinical excellence. That's what we're trying to really resonate with other chiropractors, is how to do more for your patients, how to better our profession, and how to just get awesome outcomes. That whole saying, what gets measured gets managed, is something that we talk about all the time with our patients. We love having objective, measurable data, not just, do you feel better? Okay, did your presenting symptom go away? But actually change someone's life and change the way that they're living for the rest of their life. Those are our goals. We're looking for other like-minded chiropractors that are interested in this. And so if you have any questions, or if you want to see more about this, check out a demo that we have showing all the pieces inside of our doctor training portal. Just go to demo.movenowu.com and you can watch. It's about a 30-minute demo, and it shows you all the ins and outs. And then if you feel like this is something that resonates with you, then you scheduled to jump on a phone call with one of our team, and we can find out if this looks like it's going to be a good fit for you, and we can fill you in all the details that you want to know from there. So hope you enjoyed this. We're going to be coming out with these on a regular basis. I feel like this is a really good way to find those doctors, hopefully you, that wants to do better by your patient. If you watch this whole video that we made, then you're probably one of those. Reach out to us, comment, let us know what you think. Feel free to ask us any questions, and keep doing great work for your patients. And we look forward to talking with you soon.